Hey everyone, we are Health Protocol, and we're here with a physical therapist. We're the duo behind one of the most trusted physical therapy channels on YouTube. And today, we're diving into a super important topic, anti-inflammatory food diet for chronic inflammation, chronic pain, and arthritis. If you're new here, welcome. We post daily tips to help you stay healthy, active, and pain-free. So go ahead, like, subscribe, and tap that notification bell. Yes, we're not above begging a little. It really helps us reach more people. All right, let's dive into how tweaking what we eat can actually help calm down inflammation in our bodies. It's pretty amazing, really. Loads of scientific studies have been popping up showing us that certain foods can kickstart inflammation, while others have the opposite effect, helping to soothe it. You know, some folks who deal with long-term inflammatory conditions like rheumatoid arthritis, ankylosing spondylitis, or ulcerative colitis have even noticed their symptoms easing up when they make changes to their eating habits. Today, I want to tackle some common questions around this. What exactly is an anti-inflammatory diet? Is it something that's actually good for us in the long run? And how long do you typically need to stick with it before you start seeing some positive changes? So let's unpack the whole idea of an anti-inflammatory diet. First off, it's probably a good idea to understand what inflammation actually is. That way, you'll see why this kind of diet can be so significant. And maybe it'll even inspire you to make these changes a lasting part of your life, not just a temporary fix. Inflammation is basically your body's normal way of responding to anything it perceives as a threat, whether it's an injury, an infection, or something else entirely. Your immune system jumps into action, sending out white blood cells to deal with the problem, like fighting off bacteria or getting rid of cancerous cells. However, with autoimmune diseases, it's a different story. In these cases, the inflammation becomes chronic and isn't the normal protective response. Autoimmune conditions happen when your immune system mistakenly identifies your own healthy cells as something harmful and starts attacking them. This is what's going on in conditions like rheumatoid arthritis, psoriasis, ankylosing spondylitis, inflammatory bowel diseases, certain types of thyroiditis, type 1 diabetes, multiple sclerosis, and a whole bunch of other illnesses. We're still not entirely sure if fibromyalgia, that chronic pain condition, is also an autoimmune disease, but there's some recent evidence suggesting that people with it might have ongoing inflammation because they show higher levels of inflammatory markers. Now, if you're carrying extra weight, this is something important to pay attention to. Fat tissue actually releases molecules that promote inflammation, like leptin and cytokines. So if you adopt an anti-inflammatory diet, you might not see the inflammation go down as much if you still have a significant amount of fat tissue, simply because that tissue itself is releasing these pro-inflammatory substances. Now, please keep in mind that what I'm sharing here is for educational purposes only. If you have a medical condition that needs specific advice, please talk to your doctor. And if it's an emergency, head to the nearest emergency room. I generally don't advise my patients to go on a really strict diet for just a few months and then go back to their old eating habits. I don't think that approach really works in the long run. My philosophy is all about making healthy eating a permanent part of your lifestyle. If making all these dietary changes at once feels overwhelming, try focusing on one thing at a time. It's much better to make slow, steady changes that you can stick with than to give up because it feels too difficult to maintain. So what exactly is an anti-inflammatory diet? I have a feeling it won't be a huge surprise, as a lot of it is just good common sense. And if you know someone who could really benefit from this information, please hit that share button below and send it their way. Okay, let's get into some specifics. First up, try to steer clear of white bread, white flour, and gluten. Instead, look for gluten-free options like almond flour, oat flour, brown rice flour, corn flour, tapioca flour, or cassava flour. Number 2, cut back on white sugar, any kind of added sugar, and artificial sweeteners. A good swap is homemade sugar-free jams or just plain fruit, which naturally contains sugars. It does take some time for your taste buds to adjust and really pick up on the natural sweetness in fruits, vegetables, or milk. But once you train them to appreciate foods without added sugars or sweeteners, you might be surprised at how overly sweet things taste when you do add them to your drinks or food. Third, ditch the soda pops and any kind of carbonated drinks. Instead, opt for water, homemade teas, freshly squeezed citrus juices like orange, lemon, or lime, or berry smoothies. Berry smoothies made with strawberries, blackberries, raspberries, and blueberries are fantastic. Number 4 is all about avoiding processed foods and loading up on fresh, raw vegetables and fruits. Instead of processed meats, try buying raw meat, poultry, or fish and cooking it yourself at home. It makes a huge difference compared to pre-packaged meats or fish. I've noticed that a lot of people aren't entirely sure what processed food really means. A simple way to think about it is to look at the food in front of you. Is it in the same state you'd find it in nature? If the food has been cooked, canned, frozen, packaged, or had things like fortifying substances or preservatives added, then it's processed. Even a very healthy ingredient can be processed and lose all its good qualities. Take fish, for example. Fish is generally very healthy, and we'll talk more about that later. But if you buy a box of fish that's been prepared in a factory, fried in unhealthy oil, and loaded with preservatives to make it last longer on the shelf, then it's processed fish and not as beneficial. Number 5, stay away from unhealthy fats like trans fats or hydrogenated oils. Just take a look at the labels, and you'll find these unhealthy fats in a lot of things, including margarine, shortening, packaged meats, hot dogs, cookies, muffins, cupcakes, frozen pizza, microwave popcorn, and so much more. Instead, go for healthy fats like extra virgin olive oil, canola oil, and nuts like walnuts and almonds. I actually made another video all about omega-3 fatty acids, so you might want to check that out. Oh, and if you're finding this video helpful so far, give it a thumbs up right here. Let's keep going. Number 6, try to reduce the amount of red meat you eat. You don't necessarily have to cut it out completely if you're aiming for an anti-inflammatory diet. I have another video about vitamin B12, and it talks more about the deficiency of this vitamin, especially in people who significantly limit red meat. But it's a good idea to limit your red meat intake, maybe to just once or twice a week, or even just one meal per week. Replace it with things like beans, lentils, chickpeas, whole grains like quinoa, farro, brown rice, or oatmeal. Also, green leafy vegetables like spinach, kale, and broccoli are highly recommended. Number 7, limit your alcohol consumption. You don't have to completely eliminate alcohol, but it's important to reduce how much you drink for several reasons. First, to avoid intoxication, also to prevent alcohol use disorder, and also because alcohol contains a lot of calories, which can contribute to obesity. Instead of sugary cocktails, beers, and spirits, try opting for red wine. 1 glass of red wine a day is generally considered safe, and it's rich in antioxidants. Number 8, be mindful of your coffee intake. You don't have to give up coffee entirely, as it does have some benefits. However, drinking too much isn't the healthiest habit. Plus, you might be adding a lot of extra cream, milk, sugars, or sweeteners to your diet because of your coffee. Consider replacing some of your coffee with green tea, for example. Green tea is packed with antioxidants and other healthy compounds. Number 9, avoid packaged snacks, especially when you're in a rush, feeling hungry and tired. You know that moment when you get home after a long day and just want to grab something quick, sit down, and relax for a bit? That's often the danger zone. Try to have containers of healthy snacks readily available. Keep individual portions of nuts or fruits handy. Keep leafy greens in your fridge, washed and ready to eat. Just toss them with some olive oil and vinegar for a quick and nutritious salad. Leafy greens like spinach, kale, and collard greens are excellent anti-inflammatory ingredients, and you can really incorporate them into your diet in many ways. Throw them in smoothies, meat, or bean dishes. They're a fantastic way to boost the nutritional value of your meals. Now, the thing to remember is that an anti-inflammatory diet is a healthy diet overall. So, even if you don't have chronic inflammation or chronic pain, you can still benefit from adopting this way of eating. To make it easier to stick with this kind of diet, I often recommend what I call the Pikey approach. P stands for plan. Before you even go to the grocery store, plan out your meals, including the recipes and the ingredients you'll need. Make a detailed shopping list. S is for shopping. Stick to the ingredients on your list when you're at the store. Of course, if you see a similar ingredient that's on sale or in season and you can easily substitute it in your meal plan, go for it. But try to avoid the aisles filled with processed foods, sweets, artificial drinks, and canned goods. Spend more time in the produce sections, exploring different vegetables and fruits. Be a little adventurous. C is for cook. Try to cook most of your meals at home. Limit takeout and restaurant meals to very special occasions like birthdays or anniversaries. It might be a good idea to invest in some nice kitchen tools, maybe a slow cooker, a good blender, measuring tools, and other helpful utensils. If finding time to cook is a challenge, try cooking larger batches of food once or twice a week and freezing individual portions for later. And finally, E is for eating mindfully. Take your time to truly enjoy your meals. Eat mindfully, paying attention to the aroma, the colors, the texture, and the taste of your food. Eat slowly, and if possible, make mealtimes an opportunity to connect and socialize with family, neighbors, or friends. At my own home, this is pretty much how we do things. I've memorized most of the recipes we make regularly, so I don't usually need to make a list anymore, except when I want to try something new. Then, I bring my list of ingredients to the grocery store. I only shop once a week. I try to avoid going more often because I know I'll inevitably end up buying some unhealthy things that catch my eye and I can't resist. Then, I cook dinner every evening. I usually calculate for about 8 portions. That's because we're a family of 4, and we always eat the leftovers for lunch the next day. If there are more than 8 portions, I freeze the extras in single servings for those days when I'm super busy or just feeling lazy. I also prepare a healthy breakfast every morning. We eat dinner together as a family most days. Lunch is a bit different since we're usually at work or school, but we always bring our lunch boxes with us to warm up and eat there. Remember, we are what we eat. So, keep an eye out for my next video. I like to talk a lot about vitamins, nutrients, and diet on my channel because it's a topic I believe is incredibly important, and not enough doctors emphasize it enough to their patients. And don't forget to subscribe to the channel. Goodbye for now.